Hello, everyone, and welcome. Tonight, we're tackling a real pain in the head, migraines. Joining us tonight is Dr. Khan, a leading neurologist who specializes in migraine treatment and research. Dr. Khan, thanks for being here.
It's my pleasure. So, tonight, we're diving deep into the world of migraines. We'll separate fact from fiction. We'll explore the science behind these debilitating headaches. And, most importantly, we'll arm you with the knowledge you need to find relief and take back control. Let's get started.
Dr. Khan, let's start with the basics. Dr. Khan, what exactly is a migraine?
Elena, a migraine is not just a bad headache. It's a complex neurological disorder with intense symptoms.
How is it different from a regular headache?
Migraines can involve nausea, vomiting, and sensitivity to light and sound. Some people experience visual disturbances, like seeing spots or flashing lights.
Are there different phases of a migraine?
Yes, migraines often have phases: prodrome, aura, headache, and postdrome. The postdrome phase can leave you feeling drained and out of sorts.
Okay, so we've got these phases, a whole symphony of unpleasantness. But what triggers this neurological orchestra in the first place?
The exact cause of migraines is still being researched. It involves abnormal brain activity affecting nerve signals, chemicals, and blood vessels. Triggers vary from person to person. Common culprits include stress, sleep changes, and certain foods. Keeping a migraine diary can help identify specific triggers. This helps develop a personalized prevention plan.
Speaking of prevention, what can people do to stop these migraines in their tracks? Is there a magic cure?
Unfortunately, there's no one-size-fits-all cure for migraines. However, there are many effective treatments available, both to prevent migraines and to manage symptoms when they do occur.
Let's talk meds. What kind of medications are we talking about here?
For acute migraine attacks, pain relievers, anti-nausea medications, and triptans, which specifically target migraine pain pathways, can be very effective. For prevention, your doctor might recommend medications like beta blockers, antidepressants, or anti-seizure drugs, depending on the frequency and severity of your migraines.
And what about non-medication options? I'm all for modern medicine, but sometimes a more holistic approach can be helpful.
Absolutely. Lifestyle modifications can play a significant role in migraine management. Stress reduction techniques like yoga, meditation, or deep breathing exercises can be beneficial. Regular exercise, a healthy diet, and consistent sleep patterns are also crucial.
So it's a two-pronged approach: medications to manage the symptoms and lifestyle changes to address the root causes. Dr. Khan, are there any long-term health risks associated with this condition?
That's an important question, Elena. While most people with migraines live healthy lives, there are some potential risks to be aware of. For example, having migraines with aura can slightly increase the risk of stroke, especially in women who smoke or use oral contraceptives. So, ladies, if you're experiencing migraines with aura, talk to your doctor about those birth control pills.
And what about the genetic component? Is there a family history of migraines we should be aware of?
Genetics definitely play a role. If you have a close relative with migraines, you're more likely to develop them too. However, it's important to remember that migraines can affect anyone, regardless of family history.
Dr. Khan, migraines can be incredibly disruptive to daily life. What are some ways people can cope with the challenges of living with this condition?
You're absolutely right, Elena. Migraines can impact work, relationships, and overall quality of life. One of the most important things is to acknowledge the reality of your condition and not try to push through the pain. When a migraine hits, it's essential to create a calming and supportive environment for yourself. Rest in a dark, quiet room. Apply a cold compress to your head and stay hydrated.
And what about the emotional toll? Migraines can be incredibly isolating and frustrating.
They absolutely can. That's why it's crucial to seek support, whether from loved ones, a therapist, or a migraine support group. Connecting with others who understand the challenges of living with migraines can provide invaluable comfort and encouragement.
Dr. Khan, this has been incredibly informative. As we wrap up, what's the most important takeaway you want our viewers to remember?
If you're struggling with migraines, please know that you're not alone and effective help is available. Don't hesitate to reach out to a healthcare professional, ideally a neurologist specializing in headache medicine, to discuss your symptoms and develop a personalized treatment plan. Because everyone deserves a life free from the grip of migraines.
Dr. Khan, thank you so much for joining us tonight and sharing your expertise.
It was my pleasure, Elena. Take care of yourselves, and we'll see you next time.